Got it. Yeah, thanks everybody for allowing me to present remotely. Sorry I couldn't be there in person. So yeah, my name is DiGuiseppi, and I just defended my dissertation. And this was one of my studies for my dissertation. So using machine learning to predict homelessness among young adults in substance use treatment. And I'm at the Suzanne Dwork Peck School of Social Work. So the rationale behind this study is that there's been a variety of studies looking at sort of correlates or predictors or risk and protective factors, however you want to conceptualize them, of experiencing homelessness among young adults. And these are pretty well known among the general population of young adults in the US. Things like trauma, adverse childhood experiences, poverty, identity, certain identity groups such as LGBTQ plus young adults. But this is surprisingly not very well known among young adults who are entering substance use treatment. And substance use treatment could be a setting where homelessness could be identified, or risk of homelessness could be identified and addressed. So the goal here was to so-called predict homelessness among those entering treatment. So the data source involved just over 40,000 young adults entering treatment in the US. The sample was primarily male, non-Hispanic, white, about 2/3, and primarily criminal justice system involved. And 22% had experienced homelessness in the past year. And that was the main sort of criterion variable or outcome or classification variable that we looked at, was the experience of homelessness in the past year, binary variable, yes or no. So I'm going to get into the models, but first the features or the independent variables that we looked at. And I kind of split these up into different domains. So these are domains that have been associated with homelessness in previous studies among youth and young adults. And so I split these into sort of thinking about demographic factors, family and peer relationships, education, employment, and income, victimization and criminal justice involvement, mental health, and substance use and treatment experiences. So these were the features used in the machine learning models, classification models that I used, and predicting whether somebody reported experiencing homelessness in the past year at treatment entry. And I should say that all of the young adult participants in this data set, they all completed an intake assessment when they entered treatment. And that's when all of these variables and data were collected from self-report. So for this study, one thing that I wanted to do was to compare the results of 3 different machine learning models. So 3 models that are often used in classification problems. So first, we have stepwise logistic regression, which adds or removes predictor variables or features depending on AIC criterion. Second was penalized logistic regression, and we ended up using a lasso model, which shrinks unimportant variables down to 0, the coefficients of those. And then third was a random forest model. So, and for that, I aggregated 500 decision trees, and I used the Gini index to rank variables based on their importance to the model. And it was also found that in an early instances of the models that we had good specificity, but not so good. Another marker, I'm sorry, I'm forgetting the name of it. So anyway, that was due to an imbalance of the outcome, we believe. So we used down sampling to sort of address that imbalance in the outcome. So in terms of the model performance, across the 3 models, the models correctly predicted about 2/3 of all cases as either experiencing homeless or housed. The sensitivity, which was the word I was looking for before, was pretty good across the models. About 3/4 of all cases who had experienced homelessness were correctly identified, and the specificity roughly up to 2/3 were correctly identified. Those were the stably housed cases. The area under the curve was slightly lower for the random forest model compared to the logistic regression models. So that was the sort of main difference between the models and their performance. So I'm going to go into the results in terms of the top features that were most strongly associated with the outcome, predicting homelessness or not. So you can see the top 10 from the 3 models are displayed here. I'm going to kind of go through the different domains that I talked about before. So in terms of demographics, the logistic regression model tended to favor demographic variables such as being Hispanic or sexual gender minority. Family and peer variables were quite different across all 3 models. In terms of education, employment, income, working or being in school was an important protective factor in that it was associated with lower odds of homelessness across all the models. And victimization and criminal justice involvement were important, as is shown in previous literature. Mental health came up as more important, it seemed, in the random forest compared to logistic regression models. And substance use and treatment, particularly substance use disorder symptoms and using stimulants were important across most of the models. So just to wrap up in terms of the implications and discussion, so among young adults in substance use treatment, the rate of experiencing homelessness is about twice that of young adults in the general community, which indicates that this is an important domain or setting to address homelessness in. The models correctly predicted about 3/4 of all cases, and there were some similarities and differences across models, which could reflect the strengths and limitations of the different models used. So random forest has been talked about, or decision trees is often talked about being used with problems that are highly, there's complex interactions, and logistic regression may be more appropriate for issues that are more additive or linear in nature. And some limitations of the study are, number one, there's some issues of temporal ordering. So I actually don't believe that it's correct to say that we're predicting homelessness here, because there were some issues in terms of timing of the different variables together. And, you know, to be more specific, I think future research may be a bit more useful in terms of intervening on homelessness if we can look longitudinally over time and we can see kind of what predicts future risk of homelessness, so that we can hopefully learn from that and intervene to prevent experiencing homelessness during and after treatment. So to sum up, this may help identify young adults who are at higher risk of experiencing homelessness as they enter treatment, and also could inform tailored treatment, such as young adults experiencing homelessness may benefit from employment or education services, or treatment services that may be focused more on using stimulants, etc. And thank you, that wraps it up.